just admitted to the hospital because you're having loss of balance, confusion, and double vision. The doctor has been running tests to see what could be the cause. He finally figures out the issue, comes into your room, and diagnoses you with multiple sclerosis. You start to panic and ask, what is multiple sclerosis? What treatments are there? Hi, my name is Eva Sweeney, and today I will inform you what is multiple sclerosis, what part of the body it affects, and how it can be treated. Let's begin to discuss exactly what is multiple sclerosis. The Multiple Sclerosis Society defines it as an immune-mediated process in which an abnormal response of the body's immune system is directed against the central nervous system, which is made up of the brain, spinal cord, and optic nerves. The exact antigen or target that the immune cells are synthesized to attack remains unknown, which is why MS is considered by many experts to be immune-mediated rather than autoimmune. The immune system attacks the myelin sheath, which is a fatty substance that surrounds and insulates the nerve fibers. To give you an exact representation of what the myelin sheath is, I prepared this PowerPoint slide for you. And the top is a neuron with myelin sheath surrounding it. The yellow part is the myelin sheath. And then the bottom one is a neuron with someone with MS. And you see that the myelin sheath is missing from there because the body has attacked and destroyed the myelin sheath. And as a result, you get distorted nerve messages between your bodies, so you could lose the ability to walk and all your functions, like different things. So that's the myelin sheath. People with multiple sclerosis can experience one of 4 disease courses, which can be relapse-remitting, secondary progressive, primary progressive, and progressive relapsing. To give you an exact representation of what the different kinds are here, I put a chart of the y-axis is the increasing disability and the x-axis is over time. So for the progressive relapsing, it's steady decline with some attacks. So you see the increase in disability, but you'll have some attacks like over time. And then secondary progressive is initial relapsing remitting, and then it's just like a steady decline in disability after that. You could stop also with your disability, and then primary progressive is there's no attacks and you just keep steady disability throughout your life. And then relapse remitting is you have like declines and then you have relapses and stuff like that, so you have those attacks on and off. And you could be completely normal with relapse remitting, you can still have your ability to walk and such things. According to the book Multiple Sclerosis, Causes, Diagnosis, and Management, the common symptoms of people with MS include fatigue, bladder dysfunction, double vision, and cognitive dysfunction. I've also included a slide of the main symptoms of multiple sclerosis, and it gives you kind of like a diagram of where different symptoms occur in the brain, vision, speech, throat, and different things such as that. Now that we know what multiple sclerosis is and what part of the body it affects, we can see the options for treatment. According to the book Multiple Sclerosis and Related Disorders, Clinical Guide to Diagnosis, Medical Management, and Rehabilitation, the treatment of MS includes 3 parts. Treatment of relapses, prevention of MS activity, and management of symptoms. DMT, which stands for disease-modifying therapy, is to reduce disease activity, but it does not typically restore function or improve symptoms. Medicines used for DMT are Avonex, Copaxone, Rebif, Extavia, and Tysabri. All of these drugs decrease the frequency and severity of clinical attacks, decrease the appearance of new symptoms, and slow the rate of disability progression. Also, patients undergoing disease-modifying therapy should expect an MRI every 6 months to track the disease. According to the book Multiple Sclerosis, Causes, Diagnosis, and Management, Other treatments for MS patients involve symptomatic treatment, which involves focusing on the symptoms that arise by the disease and have a serious impact on life. For example, spasticity of muscles. Stretching and physical therapy is of course suggested to reduce spasticity of muscles, but they also have drug treatments such as tizanidine, baclofen, Valium, and anticonvulsants. According to the book Multiple Sclerosis, the guide for the newly diagnosed, there are also unconventional therapies, which can be described as alternative medicine, complementary medicine, and integrative medicine. The National Institutes of Health subdivides it into 3 categories. Biologically based therapies, which can include dietary supplements, diet, and feed venom therapy. Mind-body therapies, which can include guided imagery, hypnosis, and meditation. And alternative medical systems like traditional Chinese medicine, Ayurveda, which is like an Indian type thing, and it's kind of, you get this like, they give you a plan for like a diet and different things. It's more kind of like symbolical and stuff like that. And homeopathy. You might have seen some of those stuff like in the drugstores where they have like little things for different, like sore throat. Sometimes they're at Rite Aid and they have like the little bottles, and it's just like what would you call it? Reduced forms of like the big things to like kind of tell your body's immune system to fight whatever is going on. And I also have a slide in here that shows you an example of bee venom therapy. If someone doesn't know what it is, it's done by bees. And it's also supposed to help like different things like arthritis, and apparently they're thinking it might help cancer now, but I don't know. And then also hypnosis. I hope you now understand what multiple sclerosis is and the treatments available for the disease. There are about 10,000 cases diagnosed each year. That number is increasing every year. Hopefully soon a cure will be found, and this terrible disease will no longer cause hardships to families